I have a friend. Let's call him Joe. A few years ago, Joe was going through a tough time. He had recently gone through a breakup, and he felt stagnant in his career and had a sense of hopelessness, and it really began to set in. After trying various avenues to feel better, Joe decided to bite the bullet and go see a therapist. However, he hit a brick wall. People he'd heard of via word of mouth were booked up. The therapists he found on Google didn't take his insurance, and he couldn't find the high-quality therapy that he really wanted. I share Joe's story because I know many of you have a Joe in your life, or maybe you've been Joe yourself. You want care, you raise your hand for help, and the door feels shut. The issue of access in mental health care has long been a problem. Thriveworks, the company that I work for as Chief Digital Officer and Chief Marketing Officer, was founded with the mission to improve access. We're a nationwide provider of in-person and online mental health services. We have 340 plus clinics spread across every state, and we employ over 2,200 clinicians and offer care covered by over 360 insurance plans, the most covered therapy service available. Getting people the care they need, how they want to receive it, used to mean just online or in person. But expectations have expanded to demand 24/7 access while still delivering high-quality, human-centric care. Now, let's step back and think about the market dynamics. Today, we're contending with increased demand, expanded expectations, and still a lot of people in need of any kind of help. Roughly 2/3 of people who are diagnosed with a mental health condition are unable to access treatment. 169 million Americans live in areas with shortage of mental health providers. And the mental health workforce is in a squeeze, with clinicians not being produced at the pace of demand. Consumers are much more therapy curious and knowledgeable about therapy and what it means, but access is still hampered. So the question is, how do we make mental health care truly accessible to everyone who needs it, and in the way that they want to receive it while remaining deeply human, as any innovations in the space should enhance, not erode that important human-to-human connection. There are a ton of exciting innovations happening in AI for mental health today, and with that, a lot of concern about how AI might replace therapists and the risks involved. I firmly believe that the answer isn't replacing therapists with technology. We're tapping into the technology more of as an extension to the clinician, which will allow us to scale, access, and open new doors to care. For the future, potentially this looks like, 1, providing in-between session support to reinforce the tools clients are learning in therapy with that human. 2, providing after-hours support that can be reviewed. 3, helping to triage people requiring a more urgent level of care. And 4, for those at the top of the funnel, not ready to quite begin therapy or those who are therapy curious, it's providing an education that's immersive and explaining what to expect. We find that for many, AI isn't the end of the journey, it's their first step in. It's a taster. It's a way to get support now while they move toward therapy with a human clinician. Now let's talk about where AI is already happening, or where AI is already helping to expand access. Today, it's helping to streamline clinicians' busy work. That means drafting notes, managing documentation, freeing time and mental space for scaling their high-quality care delivery. And also, through the building of networks that are happening today, we are seeing improved client and clinician matching. We're helping people connect with the right therapist faster, which means fewer dropouts and better outcomes, people sticking with their care. 2, we're facilitating clinician communication and collaboration tools that strengthen their communities. And 3, it's integrating mental health with physical health. Our physical and mental health are deeply intertwined, but for far too long, they have been treated in silos. AI is still very immature when it comes to mental health today, and scaling responsibly also means focusing on low risk but high value use cases first. the places where AI can remove friction without compromising safety. It's less about replacement. We need to drill into a series of metrics like show rates, retention, match success, and satisfaction, more client-oriented, to truly measure success as a first step to scaling. Throughout this process, it's crucial clinicians remain connected and engaged. We call this having humans in the loop because clinical oversight and keeping the process human-centric is essential. We also have to acknowledge the risks. There's limited data in psychiatry, limited longitudinal studies in talk therapy, and some really disturbing use cases making headlines recently about chatbot involvement or lack of intervention in suicides. This calls for tight guardrails around implementation for safety. AI must be clinically supervised with clear guardrails for escalation when someone is at risk or facing challenges that require human intervention. It must be transparent so people know what it can do and what it can't. And it must be designed to support, not replace, the human connection at the heart of therapy. So what could access look like in the next 5 years? It could mean someone in what is known as a therapy desert, skipping a wait list and seeing a therapist within days, not months, because our clinicians can scale better and faster. It will unburden clinicians from paperwork to spend more time actually delivering care. It will see mental and physical health are no longer treated as separate because patients move through one connected system. Now, I hope this gave you a flavor of what I see as the future of AI and access in mental health. And I'll be around over lunch in case any of you want to discuss anything that I've covered. Thank you for your time.